Good evening to the Makah community. I'm doing a joint message with Makah Tribal Public Health Officer, Dr. Libby Cope. And this is in light of the new CDC guidance that has been released today. So Dr. Cope and I are teaming up to provide a COVID update to the Makah community. Dr. Cope?
Sure. Thank you, Mr. Chairman. So just briefly, update on the status in Neah Bay. There have still been no new cases since November 23rd. At this time, we have over 70% of the Neah Bay residents that have received the first dose of the COVID vaccine, and over 50% have received the second dose. Just let the slide go. Big in the news today is that evidence is pretty clear that the COVID vaccines prevent most asymptomatic infection and transmission. This is data that we've been following and waiting for and being extra cautious just in case this wasn't the case. So this evidence is certainly good news and stuff that we've been anticipating. So far in the United States, all of the COVID vaccines that have been used have been 100% effective in preventing hospitalization and death, regardless of the COVID variant that the person was infected with. So again, that is great data that we're seeing. It doesn't mean that everyone has been prevented from getting the infection, but when they have gotten it, it has been mild and has not led to hospitalization or death. For the purpose of the CDC guidelines and further recommendations, the term fully vaccinated is referring to those people who are 2 weeks after having received the second dose of a 2-dose series vaccine. So that's Moderna or Pfizer, or someone who is 2 weeks after having received a single dose vaccine. So that's Johnson & Johnson. What the CDC is recommending is that if you've been fully vaccinated, you can visit with other vaccinated people indoors without masks or physical distancing. And you can also visit indoors with unvaccinated people from one single household where no one with high risk resides. And then you can also skip quarantine and testing after a known exposure if you don't have COVID symptoms. The CDC also recommends that fully vaccinated individuals continue to wear a well-fitting mask and do social distancing in public spaces, and then also continue to wear a mask and social distance when gathering with individuals who are unvaccinated, and if those unvaccinated individuals have household members with high risks. It's also still recommended to avoid medium to large crowds.
I thanks Dr. Cope. The Makah Tribal Council wants the community to understand, and we want it to be clear that the previous slide that Dr. Cope was talking about, those are CDC recommendations. The CDC is not the jurisdiction that controls the Makah Tribal health protocols that we currently operate under. I think it's important to note that the Makah Tribal Council with the Makah Tribal Public Health Officer and our EOC have always gone above and beyond what the CDC recommends in many occasions up to this point of the pandemic, and that's proved to be very effective for us. So the Makah Health Officer and the Makah EOC and the Makah Tribal Council are actively reviewing the new CDC recommendations and evaluating changes to the health order and the Makah COVID-19 public health protocols. We met today and had some discussion. There's going to be continued discussion this week, and we're going to fully vet these recommendations and then take those recommendations through our process and make any necessary changes to our public health protocols that are recommended by our team. So I want to make sure the community is very clear on that. Even though the CDC is recommending this, they're not the jurisdiction that controls the Makah tribal health protocols. However, they do have experts working in this area, and we have our experts that are going to evaluate and take the appropriate action to continue to keep the Makah community safe and make sure that we're protecting our loved ones. So thanks, Dr. Cope.
Okay. Thank you, Mr. Chairman. So these next couple of slides are about the COVID vaccine clinics that we have at STIC that will continue. Certainly continuing to strongly recommend the COVID vaccines to everyone who is eligible. And those are certainly all adults living on the reservation who are 18 and older. Our COVID vaccine clinics will continue at the community hall this Wednesday from 9 a.m. to 5 p.m. It says by appointment on that slide, and I need to fix that. We are accepting walk-ins at this time now. So that is new and started last week that we would accept walk-ins. So if you don't have an appointment, please come in anyways. We are more than happy to vaccinate you. If you want to have an appointment, so you have a set time and we're ready for you, you can call our front desk at 2233. We will have registration paperwork at the clinic if in case you walk in. So we are vaccinating a number of tiers. This information is on our stick.org website, and it includes all residents 18 and older living on the reservation, all Makahs who live off the reservation, including descendants, and certainly all household members of Makahs, as well as those who, those individuals with PO boxes in Nia Bay and a number of other categories. So please visit the website, or if you have any questions about whether or not you're eligible, you can also call our COVID-19 question and concern line, and that number is at the end of this presentation. One question that has come up, or one effort that we're certainly trying to make, is for those people who are off the reservation and possibly not connected to either our social media or just our community as closely. Please talk to them. So please let your Makah friends and family know that enrolled and descendants and all of their household members are eligible for the STIC vaccine clinics. So we're really relying on those personal conversations. If you have friends or family who are hesitant about the vaccine, or they're hesitant about the second dose, certainly I'm available. I would be happy to talk with them directly. They can also talk to any of the STIC clinicians. Our providers down on the medical end are very highly trained in the COVID vaccines and how they work and what the risks are for adverse effects, and certainly are also recommending this vaccine. We all are in agreement that it is safe and effective. And we just want to have those conversations if anyone has questions about how it works or what to expect with the vaccine. These last two slides are about Clallam County. So this is also good news. Clallam County has become low risk. Their percent positive is now 1.3%, which is below the 2% threshold. That is with the data from all the way through March 5th. There were not any increase in cases or significant increase in cases over the weekend. They currently have 14 active cases and no hospitalizations. And they've also been doing a pretty good job of vaccinating. I think they might be the highest percentage-wise of vaccinated in Washington State. And then the second highest is Jefferson County. So that's also doing very well. And this is just a snapshot of that picture from their website. And that's it for me. So we've got our Makah EOC public briefing tomorrow at 11:30. It's every Tuesday at 11:30. If you want more information, certainly welcome to go to the stick.org. If you have questions, you can call the question and concern line, which is 645-6273. And I've also offered my phone number directly. So if you've got family and friends who have questions, or if you have questions about the vaccine, my direct line is 645-2224. Again, I'm more than happy to have conversations. We really want to get everyone who's eligible, those adults 18 and older, vaccinated. So that's it.
Thank you, Dr. Cope, for inviting me to join the Public Health Officer update and make this a joint announcement to the community. I do want to thank the community and applaud the community for its efforts throughout the whole year and making those personal choices to get us to this point. This is some very exciting news that, that the CDC has announced today. Once again, we're going to continue to evaluate that. And the Tribal Council certainly wants to encourage our community who has not received the vaccination, and certainly in light of this news, that we'd strongly encourage you to to get vaccinated. And if you haven't received that second shot, please do so. We realize and respect that is your own personal health choice, but it is something that we have a great deal of confidence in. So thank you again.
Thank you.